Today we'll be diving into some critical cardiac care questions that will help you ace the NCLEX. Let's get started. The nurse is caring for a client who has been treated with an antidysrhythmic drug. The client was on cardiac monitoring, but the monitor has malfunctioned. Which of the following parameters is it most important for the nurse to monitor? Select 1. 1. Blood pressure. 2. Pulse. 3. Serum drug level. 4. Potassium. You have 3 seconds to choose your answer. The correct answer is pulse. This answer is correct because the nurse should monitor the client's pulse carefully until they are able to obtain an ECG or place the client on continuous cardiac monitoring. This is the most important parameter as it gives the most information regarding the client's condition. Here's why the other options aren't as critical in this situation. Blood pressure. While monitoring blood pressure is important, it doesn't provide as much real-time information about cardiac rhythm as the pulse does. Serum drug level. Monitoring the serum drug level is relevant but doesn't provide immediate feedback on cardiac rhythm. Serum potassium. Though important for overall cardiac health, serum potassium levels don't give immediate information about cardiac rhythm like pulse monitoring. Learning objective. To recognize important monitoring parameters for clients following antidysrhythmic therapy. Background. Antidysrhythmic drugs are typically used to decrease the rate of ventricular conduction or convert a dysrhythmia to sinus rhythm. Some examples of drugs that are used include amiodarone and dronedarone. Clients who receive antidysrhythmic medications should be on continuous cardiac monitoring. Side effects of these medications include dizziness, fatigue, bradycardia, chest pain, and GI upset. In the event that continuous cardiac monitoring is unavailable, the nurse should pay attention to the client's signs and symptoms carefully. Takeaway. Antidysrhythmic drugs are typically used to decrease the rate of ventricular conduction or convert a dysrhythmia to sinus rhythm. Some examples of drugs that are used include amiodarone and dronedarone. Remember, while blood pressure, serum drug levels, and serum potassium are important, they don't provide real-time information on the cardiac rhythm like the pulse does. Let's move on to our next question. The nurse is monitoring a client on an intravenous procainamide infusion. Which of the following clinical findings would alert the nurse to contact the healthcare provider immediately? Reference ranges: potassium 3.5 to 5.0 milliequivalents per liter, 3.5 to 5.0 millimoles per liter. Select 1. 1. A noted widening of the QRS complex from 0.10 seconds to 0.20 seconds. 2. The PR interval shortens to 0.20 seconds. 3. The client's heart rate increases from 70 beats per minute to 120 beats per minute. 4. The client's potassium level is 3.4 milliequivalents per liter, 3.4 millimoles per liter. 3 seconds countdown. The correct answer is 1. A noted widening of the QRS complex from 0.10 seconds to 0.20 seconds. This significant widening of the QRS complex indicates potential procainamide toxicity and requires immediate notification to the healthcare provider. Let's break down why the other options aren't correct. Option number 2, this is a normal and appropriate PR interval on an ECG. Option number 3, the client may deviate in their heart rate due to stress, pain, or anxiety. A rate of 120 beats per minute is not the signal for the return of a ventricular arrhythmia. Option number 4, the client is slightly hypokalemia. However, this would not contraindicate the administration of this medication and would not be a priority to report over a noted widening of the QRS complex from 0.10 seconds to 0.20 seconds. Learning objective. To outline contraindications for a client taking procainamide therapy. Background. Procainamide is indicated for acute and long-term management of ventricular and supraventricular dysrhythmias. Because procainamide can be toxic with long-term use, quinidine is preferred to procainamide for chronic suppression of dysrhythmias. A baseline ECG, complete blood count, liver, and kidney function should be established prior to administering this medication. It can be given in intravenously or intramuscular and oral routes. Procainamide is contraindicated for clients with systemic lupus erythematosus (SLE), complete AV block, second-degree or third-degree AV block in the absence of an electronic pacemaker, and clients with a history of procaine allergy. Exercise should be cautioned in clients with hepatic or renal dysfunction. Takeaway. Clients taking procainamide should be monitored for excessive QRS widening greater than 50% and for PR prolongation. Great. Let's proceed to the next question. The nurse is caring for a client who just underwent emergency electrical cardioversion. Which of the following should be included in nursing care after cardioversion? Select all that apply. 1. Assess for chest burns. 2. Monitor for dysrhythmias. 3. Provide emotional support. 4. Document the results of cardioversion. 5. Provide sedation with a short-acting anesthetic. 3 seconds countdown. The correct answers are 1, 2, 3, and 4. After cardioversion, the nurse should assess for chest burns from the electrodes, monitor for dysrhythmias as the heart may react to the procedure, provide emotional support to the client who may be anxious, document the results of the cardioversion for medical records. Incorrect answer. Option 5. This may be done prior to cardioversion but is not usually indicated afterward. Learning objective. To recognize nursing care interventions following cardioversion. Background. Electrical cardioversion is a procedure that provides a synchronized countershock which is intended to allow the sinus node to regain control of the heart. The client is usually conscious before cardioversion, so a short-acting anesthetic may be administered to sedate the client. Nursing interventions that should be implemented following cardioversion include the following: maintain airway and administer oxygen, assess vital signs, LOC, and monitor for dysrhythmias, administer antidysrhythmics if indicated, assess for burns on the chest from electrodes, provide emotional support, document the procedure and results. Takeaway: post-cardioversion care includes assessing for burns, monitoring for dysrhythmias, providing emotional support, and documenting the procedure. Next question. The nurse is educating a client at a walk-in clinic about changes they should make in their lifestyle following an angina attack. Which of the following recommendations by the nurse requires clarification? Select 1. 1. Follow a ketogenic diet plan. 2. Butter with vegetable or plant oil. 3. Eat a diet rich in fiber. 4. Go for a walk daily. 3 seconds countdown. The correct answer is 1. Follow a ketogenic diet plan. A ketogenic diet increases fat intake, which is not ideal for managing angina. The focus should be on reducing fat intake. Appropriate lifestyle modification include decreasing, not increasing, fat intake. Incorrect answers. Here's why the other recommendations are appropriate. Substitute butter with vegetable and plant oils. Substituting butter with vegetable or plant oils is a healthy option and an appropriate lifestyle modification to promote cardiovascular health. This recommendation does not require clarification. Eat a diet rich in fiber. Eating a diet rich in fiber is an appropriate lifestyle modification to promote cardiovascular health. This recommendation does not require clarification. Go for a walk daily. Exercise increases blood to the heart and is therefore an appropriate lifestyle modification to promote cardiovascular health. This recommendation does not require clarification. Learning objective. Identify lifestyle modifications for clients affected by cardiovascular disease. Background. When blood flow is restricted to the heart due to the buildup of atherosclerotic plaque in the blood vessels, angina can occur. Angina is a symptom indicative of myocardial ischemia. The buildup of atherosclerotic plaque in the blood vessels can produce the narrowing of the coronary arteries, which is one of the main contributing factors to angina. It is important for nurses to educate clients on healthy lifestyle changes to reduce the chances and risk of angina and further decrease the chance of myocardial infarction. Healthy lifestyle changes can include implementing a diet that includes less salt and cholesterol, increasing exercise, reducing poor habits such as smoking, and monitoring changes in weight. Takeaway: healthy lifestyle changes to promote cardiovascular health include implementing a diet that includes less salt and cholesterol, increasing exercise, and reducing poor habits such as smoking. Now, let's address our last question. A client has just experienced an acute angina attack and is being admitted for exercise tolerance testing. The client says they are unsure if they would like to participate in the testing as they do not like needles. The client asks for more information about how the exercise tolerance test works. Which of the following is the most appropriate response by the nurse? Select 1. 1. It involves the use of a contrast medium to visualize blood flow in your heart. 2. It uses an electrocardiogram to assess the electrical impulses of your heart during activity. 3. It involves wearing a heart monitor to assess your heart activity while you go about your day. 4. There is nothing you need to be worried or concerned about as it is a non-invasive procedure. 3 seconds countdown. Correct answer is 2. It uses an electrocardiogram to assess the electrical impulses of your heart during activity. An electrocardiogram (ECG) is a test that measures the electrical activity of the heart during some form of activity, such as on a treadmill. This response is most appropriate as it provides a direct explanation to the client about how the exercise stress test works. Here's why the other responses aren't appropriate. It involves the use of a contrast medium to visualize blood flow in your heart. The use of a contrast medium is used in coronary coronary angiography, which is not associated with exercise and stress testing. This is not an appropriate response. It involves wearing a heart monitor to assess your heart activity while you go about your day. A Holter monitor is a device worn during day-to-day activities that help assess heart activity and record an individual's heart rhythm for a certain period of time. This is not an appropriate response. There is nothing you need to be worried or concerned about, as it is a non-invasive procedure. Although exercise tolerance testing is a non-invasive procedure, this is not the best response, as it does not directly address the client's question. The nurse should also never tell a client to not have any worry or concerns, as it diminishes the client's feelings and does not validate their experience. Learning objective. Demonstrate understanding of how exercise tolerance testing is used in cardiovascular disorders. Background. When blood flow is restricted to the heart due to the buildup of atherosclerotic plaque in the blood vessels, angina can occur. Angina is a symptom indicative of myocardial ischemia. The buildup of atherosclerotic plaque in the blood vessels can produce the narrowing of the coronary arteries, which is one of the main contributing factors to angina. It is important for nurses to educate clients on healthy lifestyle changes to reduce the chances and risk of angina and further decrease the chance of myocardial infarction. Healthy lifestyle changes can include implementing a diet that includes less salt and cholesterol, increasing exercise, reducing poor habits such as smoking, and monitoring changes in weight. Testing that provides information on cardiac function and exercise tolerance includes exercise and stress testing. During these tests, vital signs and an electrocardiogram are monitored. Exercise and stress testing is useful in the diagnosis of coronary artery disease. Takeaway: exercise and stress testing provides information on cardiac function. During these tests, vital signs and an electrocardiogram are monitored. Exercise and stress testing is useful for diagnosing coronary artery disease. Comment below if you have any questions or need further clarification on today's topics. We love hearing from you. Take care and keep up the great work. Don't forget to like, share, and subscribe for more nursing tips.